6875. Well, now, Congressman, that we have this bill, what do we do now? What's the course of action?
Well,
is there any?
Well, clearly there are going to be some changes necessary to make it work. I think we missed a chance, as I said a moment ago, to contain costs. I think we'd have to go back and make it work economically, business by business, industry by industry, and across our economy. I don't want to see that this bill actually prolongs our recession. We're in the deepest recession any of us can remember or read about since the Great Depression. We should be doing things to create a private sector job economy so that people, good Americans that want to work, can get back to work. That really should be our focal point, along with reducing our alarmingly large federal deficits. And so I think we're going to have to, as Congress and as people, grapple with cost containment and not try to push that issue off to the side. That is the main issue in why businesses are struggling. They need to control their costs so they can make a profit and grow and thrive. That's what you need, business by business, and across our whole economy. And I think Congress has to go back and revisit that issue as soon as possible. I'm afraid it will not happen in this calendar year. I think Congress has a little bit of health care fatigue, having spent a lot of time and energy on the legislation that was just signed. But I think as soon as possible, Congress could have to redo the cost containment to actually make it work for the small business economy of Ocean County and our country.
Okay, Congressman, how will the law affect most seniors?
To be determined. For folks with Medicare Advantage, they'll probably see premium increases, or they may see some decline in services. For folks with Medicare, this law has to be coupled with a fix in the doctor reimbursement rates for Medicare. Curiously, that measure was left out of the health care reform bill. The House has voted separately to increase reimbursement rates to doctors, because you may know doctors just saw the reimbursement rates cut by 21%. That's unsustainable. That will put some doctors out of business. They have to break even or they can't keep practicing medicine. Some of them will just stop practicing, or some of them will stop taking new seniors as patients and cut back on the time they spend with the current Medicare patient base. So that will be fixed, I hope, in the Senate side, but that's going to cost a lot of money over time to raise reimbursement rates. If we don't raise reimbursement rates to back to what they were before this cutback, you're going to see a lot of seniors struggling to find healthcare professionals that they want to treat with. And seniors, by and large, have more medical needs than middle-aged and younger people. They're going to want to have access to their own professionals, but a lot of professionals aren't going to want to treat unless they get the reimbursement rates back up to where they have to be. So that's a genuine concern that the Senate needs to deal with. Then the Congress needs to agree with the Senate to actually get that done right away, or you'll see some real shortages in health care for seniors.
You may not recall who this person is, and I unfortunately do not remember his name, but he's also new to Congress. He's either from Texas or Indiana. He's a good-looking guy with dark hair, and I was watching him being interviewed on CNBC talking about a variety of different things, and I believe he's from the Republican Party, but he said that one of the more intelligent people that have come to Congress recently is this congressman from New Jersey by the name of John Adler. And I said, well, that was very interesting. I can't think of who he is, but maybe you know, from the brief description, you can figure out who I'm talking about. I can't remember whether he was from Texas or Indiana, but also a freshman congressman. But
well, I'm thrilled to hear that. It just it sets the bar higher for me to try to work harder for the people of Ocean County and our country. I'd like to have people think of me as somebody that tries to solve problems on a bipartisan and reasonable way, and not a knee-jerk person going hard to the right or hard to the left. We need people pulling together in the middle. The nice thing is there are a lot of new members of Congress of both parties that aren't ideologically set so far to the extremes or aren't there to throw bombs at each other, but recognize that Republicans and Democrats are loyal, patriotic Americans trying to serve the people of our great country to make things better. Some of the people that have been in Washington a little bit too long tend to be far to the left or far to the right and don't want to work with people of the other party. I don't quite get that. At the end of the day, we're all Americans. We should all try to be pulling together. There could be differences in philosophy, and I certainly respect that. But to have people just say the other party is wrong and not patriotic and not committed to try to help families and seniors and businesses and veterans. I don't get that mentality. So whoever said that, I'm going to try to live up to those kind words, by recommitting to try to solve problems for Americans, not for Democrats, not for Republicans, but for Americans and for our country's long-term betterment.
Well, that was basically that was what he was trying to get across. That by working, he works together, with both parties, and you need more people like that in order to get things accomplished. Absolutely correct.
Yeah, it's alarming to see the hardcore Republicans and hardcore Democrats not wanting to work with one another. They mouth the words, but it's just not sincere. They would rather score points against the other party rather than solve real problems that our veterans face, that our small business community faces, that our seniors face, that our families face, that children face. I don't get that mentality of just trying to win politically 24/7, 365 days a year. Elections are fine. That's what you have in early November. But we shouldn't be worried about elections in December and January and February. We should be worried about seniors trying to get by in tough times, and young people trying to get their first good job, not a McDonald's job, nothing against McDonald's, but get a good job where you can work your way up the ladder and have the satisfaction of raising a family on a living wage. I don't see that sort of cooperative spirit from a lot of the people that have been in Washington for too long. But I like the person from Indiana or Texas or wherever he or she's from. That means they have the right idea of trying to help America, not trying to help their party.
Congressman, thank you for taking time out of your busy schedule to come on with us here in the Molotsky Money Hour. We always appreciate when you come on with us and shed some light on whatever happens to be the issues of the day. And obviously the health care bill is that, of course. Keep up the good work, and we will certainly have you on again here on the program.
Appreciate it.
Gentlemen, it's a privilege. You all take care.
Thank
Bye-bye.
you.
Take care.
Congressman John Adler, our special guest this morning here on the Molotsky Money Hour.